You or someone you love is watching this video because you suffer from a thyroid condition, whether it be hyperthyroidism, hypothyroidism, or Hashimoto's, which is a combination of both. I'm Dr. Michelle Asgar, author of this video, DVD, and CD. Again, you are watching this because you suffer with a chronic thyroid condition. I'm also the owner and operator of Inline Chiropractic Clinic and the Beaver County Spinal Disc Center right here in Monaca, Pennsylvania, located on Broadhead Road, Center Township. I've been in private practice since 1994, and I am also the co-author of the book, Freedom from Fat. Today we are going to talk about thyroid conditions and what makes us different from any other doctor that you may have seen, and how you can finally end your thyroid nightmare. See, we treat our patients metabolically and neurologically, and I'm going to be going over that in more detail in just a minute. But first, I wanted you to know that some 20 million Americans are affected by thyroid disorders. That's 1 in 13 people, and more than half of those people are unaware that they even have a thyroid problem, because they go frequently undetected, and what happens from there, they just become more severe. And according to the National Women's Health Information Center, 1 in 8 women will experience a thyroid disorder during their lifetime. And the reason why this fact may surprise you is because you yourself have probably never heard it explained to you. And that's because most doctors vaguely understand the thyroid disorders. So let me ask you this. Are you tired of running from doctor to doctor, only to play Russian roulette with the different medications? Here, take this drug. Oh, that one didn't work? Let's try this one. Are you tired of taking the drugs and they're still not fixing the problem? Do you continue to struggle with chronic thyroid symptoms day in and day out? Well, here's a list of symptoms. First, we're going to go over the symptoms of hypothyroidism. The first being fatigue, tired, sluggishness, cold hands or feet. Do you require excessive amounts of sleep just to be able to function? Have you noticed that you gain weight easily? Do you have difficulty or infrequent bowel movements? Are you depressed? Do you suffer from depression? Do you have a lack of motivation? Do you suffer with morning headaches that wear off by the time the day progresses? Do you suffer from thinning of the hair or excessive hair falling out? Do you suffer from dryness of the skin on the hair or scalp? Do you suffer from mental sluggishness? Again, those are all symptoms of hypothyroidism. So let's discuss hyperthyroidism. These may be anything from heart palpitations, inward trembling, increased pulse even when you're at rest. Are you nervous or emotional? Do you suffer from insomnia? Do you suffer from night sweats? Do you have difficulty gaining weight? Hashimoto's thyroiditis is a combination of hyper and hypothyroidism, and is an autoimmune disorder in which patient's immune system, your own immune system, attacks the thyroid. Patients that suffer with Hashimoto's experience some or above of all the symptoms. So let's talk about your thyroid gland a bit. Your thyroid runs our metabolism. It is the gas pedal of the body. Thyroid hormones have a direct effect on most organs of the body, including your heart, which beats harder and harder under the influence of an increased thyroid hormone problem. And that is why heart problems are often associated with chronic thyroid problems, in women especially, and perhaps why heart problems are more prevalent in women under the age of 50. See, T3 is the more actively biological hormone that is found in the thyroid. It's important for cellular function. And in fact, T4 makes up 80% of the thyroid hormone. So T4 is the one that is converted to T3 in the body's peripheral tissue. And T4 is just a precursor for the more active hormone, which is T3. So that's why when your doctor runs a thyroid panel, they absolutely must do more than just TSH. And unfortunately, I see it over and over again. So many doctors are only running TSH, and the people are not getting well. One of the problems in thyroid disorders is that you may have trouble converting T4 into T3 in your tissues. This can create a deficiency in the T3, disrupting the body's ability to properly regulate metabolism, which leads to specific symptoms. There are some clinicians treating thyroid conditions with iodine, and in my opinion, that's the absolute worst thing you can do. As a matter of fact, there's a thyroid expert out there, Datis Karazian, author of the book, Why Do I Still Have Thyroid Conditions When All My Lab Tests Come Back Normal? He states that using iodine to treat a thyroid problem is like throwing gasoline on a fire. So I am here to offer you new hope. You are again watching this video because you or someone you love suffers with a chronic thyroid condition, and I promise to leave no stone unturned. So if you're tired of dealing with this problem and you're worried about it getting worse, then sit back and learn how your thyroid condition can be helped. So again, as I said earlier, we treat our patients neurologically and metabolically, and we will leave no stone unturned to determine the exact cause of your condition. We use things such as metabolic treatments based on specific lab panels. So we look at a thyroid panel completely, a complete metabolic panel, a lipid panel, a CBC, which is a complete blood chemistry with autodifferential. We can assess your thyroid, adrenal glands, liver, kidneys, red blood cells, and gut function with the above test. All can be affected by chronic conditions. So by addressing these problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you heal faster, since glucose and oxygen are needed by the brain to function properly. We will also do sensitivity testing. This test determines if you have a sensitivity to gluten. Gluten is found in things such as wheat, rye, oats, and barley. We will also test to see if you have a sensitivity to eggs, yeast, soy, or milk. If you are sensitive to any of these food groups, it is absolutely making your condition worse. If you have the following symptoms, you could be suffering from a sensitivity to soy, eggs, milk, or yeast. Here are some of the symptoms: frequent indigestion, chronic pain or fatigue, bloating after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, vomiting often, frequent or loose bowel movements. You need to run the test to see if you have a sensitivity to any of these foods. We will also check your adrenal stress index. We can further check the adrenal glands through a test called an ASI. This is a salivary test, much like DNA testing. Your adrenal glands are your stress organs, and they react to stress. If you have been or currently under stress, then this test is an absolute must. When your body's cortisol levels are abnormal, you will suffer from insomnia and/or problems with your blood sugar. Cortisol levels can be corrected through specific nutritional protocols. We will check your immune panels because, as you know, an autoimmune disease is when the body begins to attack itself, whether it be connective tissue, joints, even the thyroid. We'll check things such as the lymphocyte subpopulation, cytokine panels, natural killer cell activity. The immune panels give us a picture of exactly what's happening and going on with your immune system, especially if you're suffering with an immune disorder. Your immune system has two parts, Th1 and Th2, and we need to find out which part is working and which is not, and only then can we successfully treat your condition. We will check you for H. pylori. We run this test to check to see if an H. pylori bacteria is present, because that will determine if there's a problem in the gut. We will then do an intestinal permeability test. This is huge. What we see from time and time again is that an individual is suffering with leaky gut syndrome. So leaky gut describes a condition where there's altered or damaged bowel lining caused by antibiotics, toxins, poor diet, or even parasites or infection. It can lead to increased permeability of the gut wall, to toxins, microbes, undigested food, waste, larger than normal macromolecules, and it has been proposed that these substances affect the body directly, while others postulate an immune system response. Neurotransmitters. We test for decreased brain neurotransmitters because neurotransmitters are vital for proper brain function. Decreased neurotransmitters can cause increased pain. We're going to check your hormone panels. We check hormone panels to determine if the patient suffers from low testosterone in males or low estrogen/progesterone in females. Symptoms related to decreased hormone levels may include things such as depression, fatigue, mental fogginess, mood swings, hot flashes, infertility, sweating attacks, weight gain, and even decreased physical stamina. And lastly, we're going to check you for inflammation. See, we may need to check you for inflammation because your system is testing, or we will do that by testing the homocysteine levels in your body, the C-reactive protein. Many patients suffering from a chronic health condition suffer these inflammatory processes. We use glutathione in our practice. It is the mother lode of all antioxidants. And glutathione cannot be taken orally in pill form as the body will not absorb it. We have seen miraculous changes in our patient population as the result of our specific glutathione protocols because glutathione is especially helpful in autoimmune disorders. Our neurologic treatments that we do here in our office is based on oxygen therapy and brain-based therapy. See, oxygen is the fuel to your brain and nervous system. Your brain and nervous system need two things to survive, and that is fuel and activation. And fuel comes from oxygen and glucose. Our brain-based therapy consists of several different things that we do here in the practice, whether it be vibration therapy, non-surgical spinal decompression, interactive metronome. So using those therapies in addition to everything that I just talked about helps us get you back to whole. Vibration therapy is where we are able to stimulate a portion of the brain, especially the back part of the brain known as the cerebellum. So we may use auditory stimulation, visual stimulation, or even olfactory stimulation by giving you different scents to fire up the back part of the brain. Non-surgical spinal decompression, another procedure that we offer here in the office, helps create a negative disc pressure and helps remove the pressure off the nerve and provides a slow stretch to the muscles, which may fire up the spinal cord all the way into the brain. And lastly, an interactive metronome. It's a computer-based program that uses visual and auditory and motor stimulation, increasing firing to the brain. So you need to ask yourself the following question. Has your condition affected your job, your relationships, your finances, family, or other activities? What has this cost you in time, money, happiness, and even sleep? Where do you picture yourself in the next 1 to 3 years if this condition isn't taken care of soon? What is this worth to you if we could improve your condition? So, as I said earlier, I am Dr. Michelle Askar. I've been in practice in Monaca, Pennsylvania since 1994, and I have successfully treated hundreds of patients with cases similar to yours. I hope you have found this information helpful, and we look forward to hearing from you to help you with your condition. You can call us at 724-774-5463. Again, that number is 724-774-5463, and we will send you information in regards to your thyroid problem and how we can help you. We look forward to meeting you. Thank you.